Very, very good afternoon. Today we are doing a dummy consult on breast implant surgery. इस कंसल्ट का पर्पस है आपको ये बताना कि एक टिपिकल ब्रेस्ट इम्प्लांट कंसल्ट में क्या होता है, किस तरह के क्वेश्चंस आते हैं एंड व्हाट आर द आंसर्स दैट यू कैन एक्सपेक्ट इन अ वेरी टिपिकल ब्रेस्ट इम्प्लांट कंसल्ट. ऑफ कोर्स सबके अपने अपने सवाल होते हैं, अपने अपने जवाब, अलग अलग जवाब भी उनके सिचुएशन बेस्ड तो होंगे ही. बट इस वीडियो में आपको ये मिलेगा कि 90% से ज्यादा आपके सवाल आज जवाब हो जाएंगे. सो दिस इज अ डमी प्रेजेंटेशन. इसका इट्स नॉट, जो पेशेंट है वो रियल नहीं है, वो मेरे स्टाफ मेंबर हैं. एंड क्वेश्चंस हमने ऑटोमेटिकली जो एक नेचुरल रिस्पॉन्स में आएंगे वही पूछे जाएंगे. सो लेट अस स्टार्ट. वेलकम मैम.
हाय सर, आई एम हेयर फॉर ब्रेस्ट इम्प्लांट कंसल्ट.
वंडरफुल.
मैं बहुत टाइम से प्लान कर रही थी, बट सिंस इंडिया में ये सब बहुत टैबूड होता है, तो
ट्रू.
इसीलिए जो सबसे
No,
कॉमन
but why do you
क्वेश्चन,
think it is a taboo?
मतलब हर जगह ये बोला जाता है कि इससे कैंसर हो जाता है,
ये टैबू का रीजन हो जाता है.
और आगे जाके शादी नहीं हुआ है तो आगे पार्टनर को पता चलेगा.
So that is, so जो I am understanding from what you are saying is कि ये आपके माइंड में एक फियर है probably कि क्या पता इससे कैंसर हो जाए, क्या पता the partner might come to know I've had a breast implant. Is there any other fear?
स्कार कितना बुरा होगा,
Scar.
कितना विजिबल होगा,
Right.
क्या ऑप्शंस हो सकते हैं स्कार को
Improve करने के लिए.
करने के
So
लिए.
scar is a major concern for you?
यस.
Okay.
एंड कितना नेचुरल लुक एंड फील होगा.
Absolutely
टच
perfect.
करने में आर्टिफिशियल लगेगा.
Look wise?
लुक वाइज तो है ही टच में, प्लस कितने वीडियोस देखते कि फट जाता है,
True.
स्पेशली फ्लाइट में फट जाता
तो आप
है.
इतनी देर से ना सिर्फ फियर ही बताए जा रहे हो अपना. सो व्हाट आई आल्सो वांट टू नो, फियर तो मैं आपका एक एक आई आंसर देम वन बाय वन. बट दिस इज समथिंग विच जिस एनी लेडी जिसके ब्रेस्ट उनको लगता है कि इनएडिक्वेट है, वो क्यों कराना चाहते हैं? व्हाई डू यू वांट टू डू दिस? आप आए क्यों हो मेरे पास?
सेल्फ कॉन्फिडेंस, कहीं ना कहीं जो आप कपड़े पहनते हो, you wanted to have that look without wearing double padded bras.
Correct.
And something
So are you aware that you can actually get rid of padded bras with breast implants?
that I saw on your video, and so
Okay,
am I
good.
here.
Correct. Now tell me one thing कि आपको एक अपने डबल पैडेड या सिंगल पैडेड ब्रा को हमेशा के लिए हटाना, would that be a joy for you?
Definitely.
Because
but again,
fears are there. So suppose I'm able to take care of your fears, then can we move towards a more positive?
Yeah, I would feel
Perfect.
much comfortable.
Now एक चीज before I start, I have to tell you this, that forever अब आप अपने पैडेड ब्रास को ना, you can burn them. So burn the bra movement है ये literally. Now you're right, most patients will come here because कहीं ना कहीं they feel inadequate. Even married women, they come here because kahin na kahin maybe the relationship is not so perfect because they feel inadequate. And you know, बहुत surprising है कि लड़की अपने आप को inadequate feel करती, maybe the guy doesn't feel it. Probably. So and that is why वो उस relationship को उतना एक उतना intimate नहीं बना पाते. So that is something which is very interesting. Now tell me something, that have you always wanted to do it या कोई incident ऐसी आई which has made you want to discuss?
Probably when I go shopping and I see dresses where
Right.
I cannot
I
wear
can
such dresses, that time I feel like, okay, why not?
I get that. No, absolutely. And dressing today,
And
your first impression is your last impression, it is
exactly.
said, and Instagram, social media,
Definitely.
and personally. Perfect. ठीक है. Is there, have you discussed this with anyone else?
Not really, because I wanted to first educate myself regarding my fears. तभी हम आगे move forward कर पाए.
Perfect. And do you think that people at your house will have any objection to doing something like this?
I live alone, तो मुझे उतना issue
Not a
नहीं
problem,
होगा.
not a problem. But so you feel you might not even want to inform,
Not.
which is fine. चलो, let's start with the fears and then so I'll tell you the flow of the consult today. So great कि हम लोग आपके fears से start कर रहे हैं. Then we'll move on to what it can create. Then we'll talk about the procedure itself, the techniques. Then what is the recovery of this surgery. and follow up program किस तरह होता है. So these are some of the things that we would like to discuss. So first of all, I'd like to start by telling you that we are amongst the innovators in breast implant surgery in India. हम dual plane technique, we have innovated that in India, and that is today the best, and I'll talk to you about that more in detail. But अभी stage पे what is important for you to know कि if you do a dual plane breast implant technique, उसमें जो अपर पोल की फुलनेस आती है ब्रेस्ट की, दैट कैन नॉट बी अचीव विद एनी अदर टेक्निक. जो कन्वेंशनल टेक्निक्स हैं, दे कैन नॉट अचीव दिस काइंड ऑफ अ रिजल्ट, एंड ऑल्सो गेट सम सॉर्ट ऑफ अ क्लीवेज. आई एम श्योर क्लीवेज इज ऑफ इंटरेस्ट टू यू.
Definitely, when want to wear such dresses.
तो वो तो दिखता ही नहीं है. सो अगर आप वो सब चाहते हो तो देन डुअल प्लेन टेक्निक इज व्हाट इज द परफेक्ट टेक्निक फॉर यू. ऑफ कोर्स इट इज अ लिटिल बिट मोर एक्सपेंसिव कंपेयर टू द अदर टेक्निक्स, बट एनीवे वी विल टॉक अबाउट दैट. ऑल्सो I'd like to tell you at this start that आपका एक क्वेश्चन बहुत इंपॉर्टेंट था अबाउट स्कार्स, एंड मैंने अंडरस्टैंड किया दैट स्कार्स आर इंपॉर्टेंट फॉर यू. सो वी हैव टेक्निक्स जिसमें ब्रेस्ट पे कोई स्कार नहीं आएगा. सो दैट इज एसेंशियल टू नो. So there are three basic technique ways of doing it. One is a cut under the breast, one is a cut on the nipple, and the third is through the underarms. So जो underarms के थ्रू है उसमें तो breast पे कोई कट आता ही नहीं है. जो nipple के थ्रू है उसमें बहुत फाइन लाइन आती है, but it is largely invisible. Having said that, जो best technique है that is always the one which is done from under the breast. Why? The chances of asymmetry are the least. बाकी techniques में there is a definite chance. The scar is hidden under the breast, तो actually नजर नहीं आता है वो. And जो dual plane technique है that can only be done with this approach. There is no other way you can do it. Now suppose हम discussion के बाद we feel कि हमें dual plane नहीं करना है, then we can discuss the underarm approach also. So we'll talk of that. तो एक काम करते हैं. आई थिंक लेट्स स्टार्ट बाय टॉकिंग ऑफ योर फियर्स. सो फर्स्ट ऑफ ऑल, कैंसर का कोई लिंक नहीं है विद ब्रेस्ट इम्प्लांट सर्जरी एज सच. इंडिया में ब्रेस्ट कैंसर रिमेन्स द मोस्ट कॉमन कैंसर इन विमेन. सो ब्रेस्ट की सर्वेलेंस करनी बहुत जरूरी है, बट एज सच द मॉडर्न इम्प्लांट्स, जो जैसे कि टुडे वी आर यूजिंग द नैनो टेक्सचर्ड इम्प्लांट्स and smooth implants. So we are using Motiva, which is US FDA and European Union approved. So they give you a very long warranty, and these are very very safe implants. In fact, you can literally twist. आप implant को पूरा मोड़ सकते हैं, आप उसको box कर सकते हैं. You can sit on an implant and nothing will happen to this. So they are very reliable, long lasting, टूटते नहीं है, perforate नहीं होते. And definitely for sure with the nano textured implants cancer का कोई linkage नहीं मिला है. So that is one very important fear I'm sure you had. Second is how natural can it be? Now breast implants are absolutely natural in their feel. Especially dual plane technique में तो implant feel ही नहीं होता. You only feel your breast tissue. So in all likelihood nobody can feel the implant when you touch the breast. More important is क्या breast implants look natural after surgery? Now the answer to this is if we do proper selection. अगर हम proper breast size के हिसाब से implant को select करते हैं, then definitely 100% natural look आती है. But कुछ patients हैं जो चाहते हैं कि unnatural लगे और बहुत बड़ा implant choose करते हैं. Say for example, अगर एक breast में 350cc implant आ रहा है का which is normal for that breast, लेकिन patient says कि मुझे तो excess में चाहिए and we do 450, obviously वो unnatural लगेगा. But then that is what the patient wants. So I'm sure that is not the case with you. You would probably like to are you into modeling?
No,
or
this is
I'm
not doing for myself.
You're doing for yourself. So I'm
And
assuming
what about teardrop implants?
I'll talk about that. But so I'm assuming that आप बहुत बड़ा implant नहीं चाहते होंगे. Good question about teardrops. Teardrop implants are a special group of implants जिनमें the difference in that is it is more flat on the top. अगर आप देखें, this is the teardrop and it is bigger on the bottom compared to a round implant जो कि completely round all over होता है ना. इसका advantage क्या होता है? Teardrops are said to give the most natural shape because किसी का भी breast top heavy नहीं होता है. But largely in our experience we have seen that the round implants is what the patients want, and round implants जब in fact what happens is जब implant ऐसे है तो ठीक है, but जब patient खड़ा होता है तो वो इम्प्लांट थोड़ा सा स्लाइड डाउन करता है एंड इट इज एबल टू गिव अ वेरी नेचुरल लुक. सो स्पेशली टीयर ड्रॉप करने के लिए टुडे आई थिंक देयर इज नो रियल नीड टू डू दैट. देन वन ऑफ योर फियर्स वाज आई थिंक वी आंसर्ड अबाउट द नेचुरल लुक, अबाउट टेक्सचर एंड द लुक. Scars we answered, we talked about cancer broadly mapped. So technique wise breast implants can be done. सो अगर लेट्स सी सपोज दिस इज, ये हमारी मसल है और ये हमारा ब्रेस्ट टिश्यू है. सो एक टेक्निक होती है जिसमें मसल और ब्रेस्ट टिश्यू के अंदर हम लोग इम्प्लांट को प्लेस करते हैं. दिस इज कॉल्ड द सबफेशियल टेक्निक. एंड देन देयर इज अ टेक्निक जिसमें मसल के नीचे जाके इम्प्लांट को प्लेस करते हैं एंड वी कट द मसल ऑल्सो. आई एम श्योर बहुत टेक्निकल होगा, आपको समझ नहीं आ रहा होगा, बट डोंट वरी अबाउट इट. So this technique, जो second technique मैं आपको बता रहा हूँ, that is the dual plane technique. And the advantage in this dual plane technique is, as soon as we cut the muscle just moves up like a spring, and the implant goes right on top. Muscle implant को grip कर लेता है, implant moves up, and you get a very nice upper pole. And because we have cut the muscle from here, यहाँ empty gap हो जाता है, the implant shifts inwards, and that is how you get some sort of a cleavage. Surgery generally takes about 20 to 30 minutes, maybe 40 minutes, and 4 to 6 hours later you can actually go back home. What do you do, if I can ask? Are you into training or into
No, I'm in a corporate job.
you're in a corporate job, so that means बहुत ज़्यादा आपको aerobics, exercising वगैरह करनी. Do you exercise also? Little bit, not too much. So good news is that within 10 days you can actually start exercising. Since you're not into heavy exercising, then that's absolutely not a problem. Suppose you were a swimmer or a aerobics instructor, so then we would have asked you to wait for 2 weeks. But otherwise, you can actually start in 10 days.
When can I start my work?
Office?
Laptop.
Laptop work you can start on the evening of the surgery.
Same dates.
हाँ हाँ, आपने सुबह प्रोसीजर किया, आप 8 o'clock आएंगे मेरे पास, 9 o'clock we do the procedure, 9:40 you're in your room, and 3 o'clock or 4 o'clock you're back home, and शाम को just take the painkiller tablet, antibiotic, and start working on your laptop. And next day, you can, if you want, you can even go to office.
Okay.
It's as simple as that. That faster recovery. All you need to do is wear a sports bra, not a normal underwire bra, because we need जो stitches आते हैं, we don't want the wires to cut the stitches. So we want a soft compression on the breast. So that is why we suggest a.
And how about, would they cause sagging?
Later?
Yeah. You are adding weight to the breast.
So what happens is, okay, that's a very good question. क्या breast implants, can they cause sagging? So if the implant is very big, then they can cause sagging after pregnancy, after number of years. लेकिन अगर appropriately sized implant है, then they don't cause sagging. And especially dual plane technique में sagging नहीं होती, because like I explained, the muscle grips the implant and does not allow the implant to fall. So unless somebody has a very, very large implant, sagging will never be a problem.
Can I see some before, after, or how would
Of course, you can check on
about like what it would look on me, what sizing
how you would.
Yeah.
So we have this program called Chris Alex. So this is a wonderful 3D simulation program. So उसमें आपकी photographs ली जाएंगी, and I believe we already have your photographs with us. So in this program, as you can see, your photographs have been taken, and a simulation has been made जिसमें अलग-अलग breast implant sizes के साथ how you would look like can be seen. So you actually have a great opportunity to kind of select. So for example, 300cc implant में it looks like this, 350cc implants में it looks like this, 375 में ऐसा दिखता है, 400 में ऐसा दिखता है. So this gives you an idea, and ये आपको images email भी कर दी जाएंगी so that you can see them at home, and this gives you an idea as to what you would like, what kind of a shape you would like. Suppose you want to have simulations of bigger sizes or even smaller sizes, we can even make that. So this gives you a great idea. इसमें आपकी ब्रेस्ट की asymmetry भी अगर माइनर से कुछ है तो वो दिख सकती है. So I think this is a great program for you to get an idea. Otherwise, अगर आपको before afters देखना है, I'm sure my team will help you see a lot of before afters. In fact, I think probably India में सबसे ज़्यादा breast implants हम ही लोग करते हैं. So you can absolutely see as many before afters as you would like. So has all your fears, questions largely been answered?
I think so. Talking to you
has made it easier for you. Wonderful.
Yeah.
So the idea of today's consult is basically to give you the confidence that इतना बड़ा procedure नहीं है. It is something very simple, and it is something which is aimed to take you out of that low confidence zone and take you to a much better zone. I'm sure you want to know about costings, etc. So my team will handle all the costings, and you can discuss about various techniques with them. And even later when you go back home, suppose you want to talk to me, just let my team know and they will fix up a video consult with me.
Yeah, and I heard there are EMI options
Oh, of
available as
course,
well.
absolutely. So all plastic surgery procedures can be done under EMI program, and you can choose 6 month, 12 month, or 24 month payment plans. Of course, उसका advantage हो जाता है that if you are in a situation where you can't pay upfront at a very small interest rate, you can easily do the procedure and pay over the entire year. So yes, it
Oh,
is absolutely available.